Welcome back to the show, everybody. You're listening to the Between Sets podcast. We're bringing you episode 53. My name is Tyler Paterson. I'm here with Tim Walcott. Say hi, Tim.
Hello.
And we are joined by the powerful and great Dr. Matt Bradbury for the second time. Thanks for coming on, Matt.
Hey, thanks for having me. It's a pleasure.
Sweet. First, I just want to outline the last time you were on, Matt. You were just about to start your April Step Challenge for the Ronald McDonald House charity that you're doing. So first question is, how is that going?
Good. I mean, we're part of the way through the month, and we've launched part one, and it's awesome. You know, I've had some comments from people. Basically, they're all posting their pictures up and tagging me in them, right? So it's been motivating for everybody seeing the message and asking, how do I get involved? But also, it's kept a lot of families doing something in terms of family time and getting off tech, right? Excuse me. So it's been nice for them to be able to go out and actually spend, 1 to 2 hours every single day, chatting and going adventuring. It's been an excuse during an interesting time.
Definitely. Are you actually surprised by the amount of steps people are doing, or do you think it would have been more, or do you think it would have been less? Do you have any thought about that?
By the people who are messaging me regularly, I think it's more. I think it's more than I thought it was going to be, which I think is great, because otherwise, if they had been working and everything else, and a lot of people work shift work, it may not have been. But people are hitting 20,000 steps and messaging me, right?
Yeah,
so people are walking in the morning and they're going back out at night, right? Because a lot of people, probably 40% of people are at home, not doing anything, not working from home either, right?
Yeah.
So it's been a good excuse.
No, that's awesome. I love seeing on your Instagram, like all your Instagram stories, or people with their Fitbit or whatever Apple Watch, and it's like 20,000 steps. And I'm like, these people are inspiring, because I don't think I do 20,000 steps, to be honest. So,
but Matt made a comment to me. He is right that like pedometers and Fitbits and Apple Watches all pick up. They pick up a lot higher count. I wouldn't say more accurate, because I have no idea which way it goes, but more. Anyway, they get a higher count than your phone. So.
Yes, I know between the phone not being on you all day, you probably get an extra 1,500 steps just throughout your work day.
Yeah, and I think there's little. I mean, I don't have any data to back this up, but I think that there's just the way that it picks up little movements. I think your phone isn't as good as the other ones, just because it's on your hand. Like I think you get more of that.
Oh yeah.
Moving, so
and plus, apparently my authorized pedometers pick up more steps compared to Apple Watches and Fitbits too.
Do they? Oh, that's great.
So people will put up their 10,000 steps and they have like 11.2, 11.5 on their pedometer, right?
Oh, true. Yeah, that'd be cool to like match it up, because I only use my phone.
Yeah.
It's like, and because of that, if I go for a walk and I don't have my phone, that's why I'm pissed. I'm like, 2,000 steps I'm not going to get. Damn it.
Well, you can guess, like 4 miles is about 10K probably for your stride.
Yeah, I have no idea, actually. Yeah.
Because I know mine, usually 3 miles will get me close to it. And then by the time I hit 4 miles, then I'm good.
Yeah.
Nice. How many steps do you think you're getting, Matt? Or / I'm assuming you're keeping track of it. So how many are you getting?
When I'm doing it, let me check.
I feel like you got to be beating all of your participants, You got to
today we
by
did
example.
11.8. Yeah, 11.8. And that was with myself walking with 3 kids just before lunch there.
Nice.
You did it while carrying 3 kids too. Wow.
Well, the girls were scootering. And then I carried the little guy for a bit of the walk just because he was upset. So
you
get him back in the stroller and he falls asleep. So
that's adorable.
It worked out good.
Yeah. Matt, you staying active? Well, I mean, obviously a strange time, because you have your garage gym, right?
Yeah, you're talking about the Dad Garage Fit Club?
That's right. That's the one and only.
Yeah, it's going well. It's been I've been trying to. I end up working out before dinner time, right? So sometimes it's a real squeeze, but for the most part, I've been hitting it 5 days a week, and then getting my steps in every day. So it's been fun. I've been consistent.
Absolutely.
Yeah.
What do you recommend for people? This is very general, of course, Matt, but what do you recommend for people that don't have a fit dad garage club in their own house?
A DGFC?
That's right.
Yeah, you know what? I think probably body weight, and there's so much stuff on YouTube now, right? To follow along with, or on Instagram, that like, basic air squats and up downs, right? Or
Definitely.
if equipment, like if you're gonna buy equipment, 2 dumbbells. Like for a
Nice.
beginner guy, probably 235s, and then 250s. 250s
Yeah,
typically is the guy weight, but for a beginner guy, probably 235s. If they're
definitely.
just going from couch to movement,
For
and
sure.
that's all you need to make a whole, the whole isolation period,
Definitely.
and in general, to be
Yeah.
fit.
It was fun. I was at my girlfriend's house for the past couple of days, and in her basement, her dad just got a little. He's got like a mat and an exercise ball and that sort of thing. Very just and a bench, so kind of very limited. But he has those Bowflex adjustable weights where they
Oh
go
yeah.
from 5 pounds to 52.5 pounds, and I believe I think 5 pound increments in between, and they're
Yeah.
not terrible. I did a workout with them yesterday. And I was like, I actually enjoy it. And Tim and I talked about, I asked Tim, would we ever get them a Modus? And he said, absolutely not.
Absolutely not.
So I was like, Tim, why do you actually think that, Tim? I actually don't remember your response to that.
I think they're useful from like a convenience perspective. Like if you're training yourself,
Yeah.
I don't think
Durability.
if I'm offering a service and charging a premium that I can really use equipment like that,
That makes
in my
sense,
opinion.
actually.
It's not that they're cheap or anything, but just it's the convenience factor that people like. And that's good if you're solo. But if you're going to charge people for it, I think having like a full rack, there's something about it that's, I mean, it's not even that less convenient.
True.
It's just the space
Yeah.
that it takes up, but we have the space. So,
Yeah,
Yeah.
I feel like the hex dumbbells are easy. Like, is that what you guys have?
mhm.
Yeah, in terms of durability, and one of the guys
Yeah.
actually was doing one of the workouts in the Instagram I saw from the gym, and his dumbbell fell off. Like I think it was a
The
cheaper
end.
one, and the end fell off. I'm
Oh,
like, could you imagine if that was just like your bench pressing is over your
yeah.
face, right?
What?
Oh my God. Oh,
Yeah,
yeah. That's
so that
Yeah.
was
ridiculous.
interesting.
Yeah.
But I
It's
hope it
actually
doesn't
good.
happen to my good ones.
Yeah. I hope it doesn't happen at Modus ever. That would be fantastic. But
Oh,
so my point is, Tim, you filtered that question perfectly. I expected something funnier, or sorry, something more, not funnier, more shock inducing. But
Oh
my
no.
point is,
Yeah.
like, I
I
think
don't
those
have a
things
good
are actually
answer.
pretty good for someone that, like, maybe goes to the gym semi regularly. I think it was nice. They were all I really needed just for a quick home workout. But I think for the
yeah.
majority of people, it'd be really good for people to get those. I don't know what the price is for those, but I'm
I mean, the
assuming less
selling
than a
point,
full rack of dumbbells.
like, why would you get adjustable over a rack? The main reason, right, is storage and convenience, right?
And money, probably.
No, they're not cheap.
Do you think it'd be as expensive as like a full rack of dumbbells?
I don't know actually. I haven't looked at that, but I don't think they're that cheap. So I don't know if money's that big of a discrepancy. I think it's mostly storage. So it's like
Yeah.
I
you just
think
like
for
put it
most
in your
people, it'd be
corner
home
and
storage.
yeah,
Yeah.
it's like you
Definitely.
don't need the space of a massive rack in your living room.
Yeah, that's true.
Absolutely.
Yeah.
Yeah.
Oh,
So to completely switch gears,
yeah,
Matt, let's get down and dirty. Let's go into the weeds a little bit. So I was
sounds good.
saying right before the podcast, I started reading Back Mechanic by Dr. Stu McGill,
Yeah,
and it's a sort of step-by-step program on what back pain is or kind of can be, and how to assess yourself for certain pathologies, and then kind of a blueprint on how to get yourself ideally fixed, what would be the case. So I know you want to talk about spine health. So my first question would be, do you want everybody to come in with an MRI/X-ray when they come in to see you for the first time, or how much merit do you put into like screening, like films actually?
Oh, you know what? Like in terms of X-rays,
Yes.
or
Yeah.
I think X-rays are an important component of the examination.
Yeah.
Um, is it dependent on a case-by-case basis? Yes, but do you want to know what's going on the inside? Absolutely. Like from a chiropractic standpoint, I think it's valuable, and I think it's great. We should keep it there. I know there's a whole other side of the story about them trying to change things in the U.S. or wherever it may be, but I think it's an
Right.
important part of a diagnostic imaging. It's inexpensive, and it's great. Like in terms of the functional testing combined with the X-rays, you can paint the whole picture and you see what's going on the inside, which works
Sure.
well.
Definitely. Do you want everybody that comes to see you to kind of have one, or you don't really care?
Usually I will order them once I've done an examination and determine it from there.
Okay.
So, if there's, red flags or underlying things, or I'm really not 110% sure what's going on with your spine, you want the best picture possible before you start manually adjusting them to know what's going on the
Definitely.
inside. I've seen some interesting things on x-rays that may not have necessarily been picked up during a physical exam, you
Yeah.
know?
Yeah.
So it's been, block vertebrae, all kinds of things. Right?
Definitely.
And it's almost like sometimes, not always, but they may be a little more hesitant, saying, it's not always the case, but they're not interested in the full exam. And sure enough, when you do the full exam, right, which I won't, forego on anybody, you do a full exam on everyone who comes in for the sake of their health. And essentially, yeah, you wouldn't have seen things unless you had taken the picture on the inside.
True. Yeah. It
I have
definitely makes
I
sense.
have a question for you, Matt, about that.
Yeah.
And of course, this would depend on whether, assuming you're aware of this research, but if you are, what are your thoughts on the research that uh, uh, shows that maybe there isn't such a strong link between imaging and pain?
Oh,
Do you think there's an implication there with, like, maybe imaging isn't as important and x-rays aren't as important for actually diagnostic tools, or does that change anything, do you think?
so I mean, we see some interesting things like, what is it? Like, don't quote me on the stats, but let's say 30% of people have a tear at a certain age in their shoulder, and then
Yeah.
by age 70, it's like 50 to 60%, and then it keeps going up by age 80. But maybe they have no pain, but they have an almost full tear of their rotator cuff muscles, like things like that.
Yeah.
So I think there's often a disconnect between how functional we are and how we've reached our limits, right? In terms of, you have to have a decline in function before your body finally says, I've had enough, and the point the alarm bells go off. Like, you're basically, your symptoms are a sign of something's breaking down in your life. But the fire's going, the smoke's rising, and finally the alarm bells are going off. And the symptoms are just a late stage indicator often of, typically, a chronic health anyways, of something bigger underlying. And in terms of painting the whole picture, I think there's definitely merit to the fact that, um, people don't always have pain with, what am I trying to say here? I'm trying to think about how to best answer your question, Tim. I really feel that there's a disconnect between pain and function in society.
Okay.
And for me, it's to connect the dots between increasing function for people's health, right? How can
Yeah.
we help them function at their best, right? You are going to go through stages of pain in your life. Like, pain is just an indicator that you're living,
Yeah.
right? Whether it's an emergency situation is a different story, but you're always going to have discomfort to a degree. You cannot live full out and not have discomfort,
Mhm.
right?
Yeah.
In terms of, and you just have to find ways to make yourself more resilient. And I definitely, I can appreciate what you're saying in terms of, if someone comes into a practitioner and there's, no pain, but they have a terrible x-ray, would I still want to see them? Probably.
Okay.
Like, when I
Yeah.
assess somebody, but that's going to come along with dysfunctional tests as well,
Yeah.
right? So they're probably going to have a whole bunch of dysfunctional cerebellar tests, everything else when I see them, and they're going to be on the decline in strength and everything else in terms of their vitality tests. And then you take an x-ray and they're, they no longer have a curve in their neck, they're craned forward, like they're flexed forward, right? Instead of being the C, they're the regular C shape, right? And they have a kyphotic neck. Yeah, you'd still want to look after them from a functional standpoint. And that's really the chiropractic, at least, how chiropractic is practiced in my office, that message. Does that
How
help?
is your, yeah, no, that's good. I just wanted your thoughts
Yeah.
on it. So that's good. Yeah. When you were saying, you were trying to give me a good answer to my question, that's great, because I was just looking for your thoughts on it. So,
Yeah.
but what you said there, how do you practice chiropractic in your office? What does that look like? If you can kind of
Yes.
rant on that a bit.
So when people come in, there's a conversation to see where they're at with their health, and basically see if I can help them, right?
Mhm.
And then from there, we do the examination. The examination includes functional tests. If we do x-rays, we'll do x-rays if there's merit. And then once I go over all the results, they can make the decision to start or not. Most people who come in are referred. And then essentially they go through a series of checkups or visits with checkpoints in terms of progress exams to see, from point A to point B, have they improved functionally? And then point C, have they improved functionally? And generally it's going to change based on case by case, but frequency would be the biggest change, right? Like in terms of seeing some sort of neurological and spinal change, I'd be looking at someone for a season,
Okay.
right? Frequency is going to change based on how they test.
Okay.
And that's
So
the big one.
frequency of checkups, is that what you're talking about?
Yeah.
Yeah. Okay.
So in terms of, checkpoints along the way, because you always want to be objective about it, right? But essentially, um, over the course of the season, like if it's a little person, the neuroplasticity and I like to say the pliability of it all and getting a result is faster, so it require less visits. But someone who had, 35 years of poor spinal motion and traumas and everything else, no matter how small, the frequency is going to be higher in terms of checkups in the office, just
Yeah.
like supporting them with their home care too and what they can do on their own.
Yeah. Yeah. That makes sense.
Yeah.
Yeah. I think, how long have you been a chiropractor now?
This is the 9th year.
Oh, okay. Nice. And
Yeah.
did you go to, what is it, CMCC that's in New York or whatever in Toronto?
Yeah, CMCC.
CMCC,
Graduated
that's it.
there.
Yeah.
And
Oh, okay.
yeah, there's one person who's gone since, who's been with me as a co-op student and
Oh,
then
yeah.
followed through. So
Nice. Oh,
that's
that's
nice
cool.
to see.
Yeah.
Yeah. And hoping another one soon.
Did you open
So
your clinic right after you graduated, or what was the kind of journey with that?
I spent some time as an associate for nine
Okay.
months. And then I opened up about 10 months after I graduated.
Nice.
Oh,
And
Nice.
it was a really small office, but it
Yeah.
worked,
Yeah.
and a lot of passion, a lot of love,
Yeah.
and putting it out there to the world, and that was it worked well. And then I moved 2 doors over to a 3 times the size office,
Yeah.
which serves me well right now.
Yeah.
definitely. Yeah.
Yeah,
So while you were talking about that, Matt, because I think anyone that listens to the podcast knows this already. I went from thinking I could fix everybody with my hands to thinking I
yeah,
could fix nobody with my hands. And now I'm kind of hovering somewhere in the middle. So that's why I like to be reading books or listening to podcasts or, talking to someone like yourself, Matt, that hopefully there's maybe an opposing view, or maybe because I think that makes you better. Or
yeah,
even if it's an echo chamber, it just makes me go, okay, other people are also thinking this. So I like it.
yeah,
But let's see how this hits your ear. I think when it comes to x-rays and MRIs, knowing what we know about, I think it's important to know to rule out red flags. But then
yeah,
to Tim's point about the research that him and I have dove into, is it just an age-related change that is seen in asymptomatic people anyways? So I think, what do you think about people getting x-rays, but them not knowing the results?
in terms of they don't get the results.
Like you get the results, but the
Yeah. You
patient
mean the
doesn't actually
clinician
hear it.
seeing it, right? But the patient not knowing necessarily?
Because I think some people knowing their X-ray results or MRI results, I
Yeah,
think it affects them possibly in a negative way. So it kind of gives them a nocebo of, oh wow, look at all this damage. I can't do anything now because I'm going to make it worse. So I was just trying to think of ways that like maybe people don't need to know the results, but that sounds so unethical. So I'm like, but I'm trying to save someone from thinking they're more broken than they
Themselves.
actually are.
so
Yeah.
I like it's my job to make sure people have hope when they come in, like in
Yeah,
terms of making a change. And
exactly.
my language is very worded that there's hope, and my language is more wear and tear on the body versus devastating effects of poor spinal motion, right?
Right.
Like when I frame it to a patient, it's that there's hope for you, we can make a change, and this is where the areas of wear and tear are and where we could do better,
Yeah, for
right?
sure.
So, part of that's going to be me, but I'm big on the exercise. And you mentioned about you went from full spectrum, like from thinking you could help everybody to
Yeah.
thinking you could kind of help no one.
Yeah.
So I really feel like, especially in the last year or two, like the biggest impact you can have on people is adjusting from here up,
Okay.
right? And, to our listeners, I'm talking about above the Atlas or above C1 in terms of their mindset, right?
Right.
In terms of how they view health, and you know and to my earlier point about pain is going to come and go, like in terms of you being alive, but what's important is focus on the right factors that keep you functioning well.
Right.
And many of those things I talk to people in the office about in terms of how to help their body work better. And yes, chiropractic is an important part of the equation, but there's also things you have to do to support how you look after yourself on the outside of the other, you know, or 23 and a half hours or whatever it may be a day, right?
Yeah,
Do
exactly.
you
Yeah.
Good point.
do you practice chiropractic differently than a lot of other chiros? And if you do, how would you describe the differences there?
I would think that there's a beautiful spectrum. Like when I think about the diversity in the profession, it's really nice. And that's why my suggestion for people, like if you're listening, is go and interview two chiropractors. Like when you're, and most people will do a complimentary phone call or something, and if they, or consult, but if they don't, ask them to chat on the phone, book some time, right? You can see my hanging out with my girls there, right?
I was gonna
Yeah,
ask you. Yeah.
yeah, yeah. Might as well just bring that up. It wasn't me.
He's been
Right?
watching RuPaul.
Yeah, apparently I got my nails all painted and my most of my toes too.
You should have said they
But
were bruises, like you dropped weight on your fingers, because it looked like your nails
oh
bruised. You know?
gosh, I hope not, man. Last time I dropped a plate on my foot, it was a 10 pound and it hurt.
Oh.
Yeah.
So back to what I was saying, there's a nice spectrum, and that's what keeps it interesting for people. You just have to go and talk to people. Like if you want a chiropractor, I always suggest go and interview two of them for 10 minutes, see who's a good fit for you, and then go from there, right? And that where you make your investment of your time and your energy can be a good fit for you, right? And in terms of answering, was it Tim you were asking about the spectrum and how I practice?
Just the
Um,
differences, compared to kind
yeah.
of other chiros, conventional.
So, aches and pains are a talking point for most people. That's what they understand coming from medicine. But my interest is, how can we help you work better? And how can we help your brain perceive your body better
Yeah.
in terms of your spinal function? And most of many of the things I talk about are from Heidi Havoc, Dr. Heidi Havoc out of New Zealand, New Zealand Chiropractic College. She has a fabulous resource on the web, actually, the Reality Check, and she puts it together, puts the research together really well. And a lot of my little educational videos in the office are from her. But basically, you have this system, your nervous system communicates to your whole body, controls all these important things. All we want to do is make that system work better, right? Do all these neat things sometimes change? Yes, right. That's the neat part about chiropractic. But at the end of the day, can we improve spinal function? Yes, like we can help with that. And can we help get you back to health? Absolutely. But at the end of the day, it's your body that divides the cells, and your mindset that hopefully improves or changes to get you out of a rut or get you back on track.
Definitely. That's awesome. I remember when you came on the first time, Matt, I asked you what your perception of a chiropractic manipulation was. And your answer was it made me happy because it had nothing to do with like, I'm putting bones back together, your joints back together. But
Of
yeah,
course.
what do you think manual therapy, God, this is gonna be a strange question to ask, Matt, just because I don't want to be like, what do you think you're doing with your hands? Go, like, and not to give you, I need more context, I think. But do you think every person needs a hands-on, or so I think to parlay off what Tim was saying, do you think when someone comes in, are you like, let's get you adjusted? Was it your first thought or no?
So I think that's really important. But I think it's important, like, you notice my language is checkup versus adjustment,
Nice. Yeah,
right?
absolutely.
So I think it's important that everybody's checked at some point in their life, preferably early on, because your pruning and your neuroplasticity is high in the first couple of years of life, ideally
Right.
from birth, and
Yeah.
then periodic checkups, key term checkups throughout life, right?
Nice.
Because whether you adjust a baby every single time you see him or her is different. Whether someone, you have your markers, your indicators, and you can say they don't need an adjustment that day, right? You're still doing a checkup, right? No different than, easy one to relate to. Did we talk about the dental example last time?
I don't
I
know.
think
I don't
so.
remember.
I don't
Like
know.
most people understand I'm going for a checkup every 6 months.
Right.
Whether or not
Right.
you drill every single cavity is a different story. No different than
Mm.
going to the optometrist, right, Tim?
Yeah.
Like
Yeah.
you're going to get your eyes checked. Like I have no idea if I've desensitized over 2 years.
Yeah.
And all of a sudden he puts that thing in my eye and I'm like, oh, I can see. right?
Nice.
It's like, oh my goodness, what was going on for the past, 24 months,
Mm-hmm.
right? It's not
Yeah.
until you have it measured by a professional where you're like, oh, right? And at least you have information now. Do you want to do something about it or do you not want to do something about it? Then it's your
Right.
choice. As long as you inform somebody about what's going on with their health, then they can make the free choice from there.
Right.
What are your thoughts on that? Could that information be harmful in some instances, do you think? Or no? Is it always a
If
good
they
choice?
if they test positive, like
Sure,
if
depending on the test, I suppose. Yeah, yeah.
so sorry, how do you mean? Like which
Um,
information?
yeah, that wasn't a great question, or it didn't have enough context. Do you think, well, keeping it general, just because I don't have a specific like
Yeah.
hypothetical for you, is um, do you think there's instances where someone would be better off not knowing certain things about their body?
You know what? I think it's important. It's how it's presented by the practitioner,
Okay,
right? In
explain.
terms of the context, right? And I
Okay.
think it comes back to the language you use, because it can
Okay.
either be devastating language, and you can use heavy words,
Mm-hmm.
and depending on the person, they take it really deeply, right? And they go
Mm-hmm.
home and they're sad about it, and they have this huge quote unquote problem. And it comes down to scare versus care, right? And
Yeah.
that's many of my mentors use that term, scare versus care. You want to look after people, right? If your intent is to scare them into care, then that's not my intention, right?
Right.
You want to
Of
look
course.
after them, give them all the information they need,
Yeah.
and meet them where they're at
Yeah.
with the language that they use to present their problem to you, and then hopefully put together a plan of action to see them through, so they get the jump start, the battery cables on,
Sure.
and go from there.
You
Definitely.
know what you're saying before with the checkups.
Yeah.
Would you, going off that? Do you think? Uh, and I think maybe you'd already kind of implied this, but do you think everyone should go see a chiropractor regardless of subjective symptoms? And if so, why?
100%
Okay.
in
Why?
terms of checkups,
Hmm.
simply because you don't know what's going on the inside, right?
But
Like
if you
it's
don't feel pain, why does that matter?
so typically there's a small percentage of your nervous system that actually deals with pain
Hmm.
versus the other, 80 to 90% deals with functional things you never think about.
Okay.
So some of the really important things are like, why would it be suggested that you go every year to your medical doctor? Like, why is he putting a cuff on my arm? I don't have arm pain,
Hmm. Right.
right? Why is he putting a needle in my arm? I don't have a problem with my arm,
Hmm.
right? What does high cholesterol feel like? Right? What does high blood
That's a
pressure
good point.
feel like? What does a
Yeah.
cavity feel like? Right? Like what does poor
What would
eyesight feel
be
like?
okay? So going off that
Yeah.
analogy, what would be equivalent comparisons to that in chiropractic? That would be something that I wouldn't feel, but would matter that you could uh, uh, examine for.
So I think the easy way to describe it is, when you're assessing someone, you're looking for lack of motion and
Hmm.
where they don't function very well, right? So all the tests on the practitioner side don't, it's important for me to understand it and describe it to you in a way that's easy to understand. But think about your joints don't move very well, right? And if you don't have good joint motion in your spine, you get less feedback to your brain and less awareness,
Okay.
right? So you want lots of positive information feeding your brain, whether it comes to balance, overall health, your input output system. That's the system that you work with as a chiropractor, at least the way, it's practiced in my office, right?
So would that look different when you're talking about function there? Would those tests look different than say, because I'm just trying to tease this out, right? And see what your
Yeah,
thoughts are on this is like, so say you had like an Ed Cohen power lifter, nice and like super stiff, right?
right,
You can't even touch any of his vertebrae because there's just too much muscle in between. It's like he's just too thick and everything's, too much scar tissue and just everything's so dense. It's like
right.
how he's probably not gonna, I mean, I don't know what test specifically you're doing, but I imagine he would fail a lot of them. Would that be true?
Yeah. And I
So
think,
do you think he's someone who would, you like, how would that look different? I don't even know what my question is there, other than just like
so if
someone like
someone's
that
really
might not
stiff,
even, I don't know. Go ahead. Sorry.
so if they test really poorly from a spinal health standpoint,
Hmm.
right? Yeah, so you'd still assess them up top, look at their whole spine. And it comes full circle to, we touched a little bit on the pre-show about like your stress response and allowing you to find your parasympathetics, right? So, one of the interesting things, and I say may, just because we can't be, hard and fast on everything, right? It's natural
Sure.
health.
Yeah.
But basically preface things with may as we go forward in the conversation.
I appreciate
But
it.
yeah, chiropractic may have an effect on stress hormones in terms of the way your brain perceives stress. There's plenty of studies out there now that have looked at that. And so that's the interesting part. If you get someone into a better state, what does that mean for their overall life and them seeing opportunities from a health standpoint, right? Like, you get someone who's, maybe 25 pounds overweight, doesn't move that well, and they have back pain now, they reached a limit. Well, maybe their back pain goes away, but they also make these different decisions now and they're less stressed and they see opportunities to go work out.
Right.
So overall, you've helped affect the chain of them deciding to go work out, be
Totally.
healthier. They're less stressed. They're not in a rush to eat fast food every day. So now you've just facilitated or helped facilitate them see the opportunities to go become a healthier version of themselves.
Right.
I don't think it stops at the objectives. I don't think it actually stops at here. I just tested your spinal health. Let me like adjust something to increase your spinal health. But it's also you're kind of giving them permission to move. So there's the psychological component where you're like,
Oh, yeah.
you feel better because you got checked up by hopefully an expert on the subject, and you feel better about being able to go move and maybe someone like yourself, Matt, of course, is going to give someone advice, so they just feel better. So it's funny that you actually say, because I was gonna go along the questioning path like Tim did, where if I don't have pain, why go? But it is a
Yeah.
good point to be like, maybe it is not to. So I think what Tim and I are weary about is going in to see someone unnecessarily. So like, going to see a surgeon because you have back pain is they're going to treat everything. If you have a hammer, everything looks like a nail. But I do like the word checkup. I think it's a great thought to an expert can go, oh, maybe this is going in the wrong direction. Here's the direction I'd rather you go in. So they're at a fork in the road potentially, and you steer them the right way. So I like the
And
way you change my
frame
mind on
that for
something.
people. I think it's important to frame the checkup versus the adjustment, right? Rather than let's go adjust the whole world, let's at least offer a checkup to the whole world and let them decide, right? Whether they need an adjustment or not is a different story, right?
Yeah,
But I think that's really important for language and just verbiage to the public.
definitely. Yeah.
Yeah.
I want this world to go, and I've said this, I think, on the podcast, but if I haven't, I'm going to say it again. I don't think there's a need for different types of healthcare professional. Sorry, different types of manual therapists. I don't think there should be manual therapists, physical therapists, massage therapists, chiropractor. We should all be one thing, because I think that sounds kind of weird, but I think there's one direction every person should go. Like there's patient education, there's teaching someone how to move differently, possibly better, learning how to be more resilient. There's learning about education. I think we should all get this 4-year, you learn about the nervous system, maybe adjustments are in there. And then, massage techniques are in there, whatever. I think it should be all one encompassing thing. That's easier said than done, of course, Matt. That's just my dream world. I think it'd be great. Because I think there's just too much, and people are like, do I go to the chiropractor? Do I go to the physio? And I go, well, my answer is always like, have you seen someone before? And did they help you? Maybe go back to them, because some people saw a massage therapist and the massage therapist hurt them, and they'll never go into a massage therapist ever again. So it's kind of funny how it goes, but so it's
So
always my answer.
I think that's a really important one, right? And my question for people is, did you go to a restaurant, have a bad experience, and never eat at a restaurant again?
Yeah.
Right? Like
Yeah,
realistically,
it's true.
like restaurant A, B, and C are totally different.
Yeah.
Right? So
It's so
can we
true.
pause it right there?
Oh, yeah.
Absolutely.
For a second?
Oh, yeah.
Go ahead, man. Yeah.
What's up, baby? Okay?
Get a little stretch on.
Okay.
Absolutely.
I just had to make sure she was okay going up the stairs in the boot. Are you
No
okay?
problem.
Okay. Okay.
Cool.
We're good to carry on. Sorry.
Cool. Well, Matt, I'm if anyone else is like me, they have a question about this right now.
Yeah.
I'm gonna circle back.
Yeah.
You were talking about getting someone in early because obviously the neuroplasticity and all that stuff. What does adjusting someone under the age of, I'm just gonna say, what does an adjustment for a baby look like and why?
So when you're looking at a baby, for instance, you're looking at um, objective markers, but baby's not going to talk to you, right?
Yeah.
Like when I adjusted little guy Milo, it's not like he's going to say, "Oh, this hurts," but essentially you're just looking for spinal motion amongst all your other tests, and you just want that feedback loop to happen.
Yeah.
So when you're like, you can think about the birth process as an easy one to understand: large head, small space, and you're like Play-Doh. So the sooner you catch something, the better potential there is
Yeah.
in terms of for input output. And it's like, the twig gets bent, so grows the tree with it, kind of thing. So my intention is to help your brain perceive the body at its best.
What are you looking
It's,
for when you would adjust a baby?
so when you're adjusting a baby, you're looking for spinal reflexes in terms of development, motor development, appearing, disappearing at the right times. But you're also looking at more chiropractic tests. So in terms of tension, upper neck motion, pelvic, you're looking at the pelvis. You're looking at those markers to see where their dysfunctional segments are and where there's less perception potentially between the brain and the other end.
Can you walk us through
How
that?
that
How do you get
looks.
to that? Yeah. How do you get to that point? How do you know that, how do you test that? Like, you know?
So when I look at, like, for instance, Milo, right? First of all, like when you're looking at an adjustment for a baby, it's like this, right? Like you're literally pushing your fingers together. Like, I don't know, it's like 2 to 4 kilograms of pressure, just
Mhm.
enough to blanch them, right? So the force looks a lot different than, an adult or an athletic person, right? But when you're checking somebody, like, you're just looking for motion of the upper neck in terms of when they're coming out, right? So based on having your experience and your hands on enough people, which one side's stuck, it when you're assessing their atlas, right? So C1 at the top of their spine. When their pelvis doesn't move very well, you're looking at the folds of their buttocks and whatnot, and you're looking for definition of the muscles too, muscle tone, reflexes, and the deficit side. I think that's important.
Yeah.
That's probably a good one we haven't talked about yet. Like generally, you'll see people pick up a deficit side where there'll be a right atlas shift, right, or a subluxation, and then there'll be a right pelvis sometimes as well, right? So they've become, they have a deficit on one side of the motor system, and your job is to provide input to help give the brain perception to balance things out.
Yeah. It never ceases to amaze me, that sort of stuff. I think most people's, when I see people talking about chiropractic care, or people that are dead set against chiropractors, let's say, their
Yeah,
thought is, um, how do you know it wasn't like that before? Like
right.
I've heard that before, and I go, I don't know if I think it's a fair question, but I don't know if it's necessarily a good one, because I think it's just like putting you in a corner, and you're like, well, I'm looking at going forward. So, I
Yeah,
appreciate what you're saying here, Matt, is that like you're looking about going forward with your, if the twig gets bent, it grows the tree with it. That's a great
yeah.
analogy. It's a good point. Yeah.
It's
So,
just a totally different, like, in terms of practice style, it's a totally different way of looking at the world, right? Like you're assuming the body's a self-healing, self-organized organism, right?
yeah,
And it just needs good input to help it work better. One of the
definitely.
components is a healthy nervous system and spine, and the other stuff is what I talk about in the office in terms of movement, mindset, and nutrition.
Definitely. Yeah.
Yeah.
No, you're fielding these questions perfectly, Matt, because we're essentially trying to get you to talk about chiropractic care in 1 hour, like summarize it. But no, I just like to hear your mindset on, like, when someone comes in your clinic, what does it look like? That's what we're trying to get, because it's fascinating to myself, and I think I speak for Tim as well. Like, it's just a fascinating experience. Um, we're
You
trying to
know
get.
what? Oh, sorry. Go ahead,
No,
John.
go ahead, Matt. That was it.
No, I think it's fun. Like I love answering the questions and the objections. Like that's what I
Yeah,
do, right? So I
yeah,
think it just means someone doesn't understand, like in terms of a person coming in, right? So once somebody understands, chiropractic just makes sense. in terms of how it works and the explanation of it, right? Whether or not you want to take part in it is your choice. It's
Yeah.
just like we know exercise makes sense, right?
Yeah.
Green salads make sense, right?
Sure.
In
Yeah,
terms of, are you doing
exactly.
those part-time or are you doing those full-time, right? So
Yeah.
whether you choose to take part in it is up to you. It's just as long as you know um, the consequences of not doing something,
Yeah.
right? That's okay too, right?
Yeah.
So
Well, the problem there, Matt, is that, to further your point, I guess,
yeah.
the problem is that like not every chiropractor is like you. So like that's,
Oh, 100%.
so there's a lot of chiropractors that I don't know if maybe you're going to want to stick up for these people, but don't want, I don't like any chiropractor, and I don't want any of my patients to go to a chiropractor that you go in and you have to pay a $10,000, base fee, and you have to go in 3 times a week, and you're in there for 5 minutes. They adjust the same 7 things, and then you go out the door. No talking, no whatever. They just looked at your X-ray and went, "There's a problem. I'm going to fix it over the next 7 weeks." I just hate that. So when you're saying like chiropractic makes sense, that chiropractic doesn't make sense to me at all. Like, why do
So
you think that is, Matt? Do you have any
you
thoughts
know
about
what? A
that?
lot of the time, like in terms of the high frequency and or I should say higher frequency, right? Because it's all perception, right? Like somebody may come to see me, for instance, and think, oh, like it's not in my worldview right now in terms of I can't commit to that frequency. I can't see myself in another season, right? Like what I found best earlier in the segment is most people can tangibly see a 30-day transformation or a 60-day transformation, whether it's weight loss, new lifestyle, exercise, right? We can tangibly do that for 30 to 90 days, right? Frequency is going to change based on the result you want, right?
Right.
I think is important distinction. But for those gentlemen or ladies out there, the female docs, I think everybody, you have to understand what they're trying to accomplish. And if I was just going off what you said, my thought process is probably they're doing a certain chiropractic technique that requires a certain amount of inputs over a series of time in terms of neuroplasticity and working on changing the functionality and the shape of the curve, right? With that being said, is there a lot of valid research from CBP? Have you heard of that before?
No.
Like
No,
chiropractic biophysics. So they
no.
have a ton of awesome research out there. Dr. Deed Harrison, I believe it is, in terms of spinal curves and changing the shape, in terms of input and overall health and vitality. But I think it's important you interview your chiropractor,
Yeah.
just like in the midway through there, right? Is because you have to know what the objective is and where we're going, right? And a lot of the times, you bring your medical experiences to the chiropractic office, right? And you think that, 1 or 2 visits, and then I get a script. Well, it just so happens that our intervention or our method of care delivery requires me putting my hands on you,
Right.
right? So it's a different model. And back to your point about the 5-minute visits, um, a lot of the time, like the whole front picture is front loaded in terms of understanding your health, the object or your goals, right? And where you measure, right? Like that may be 30 minutes to an hour, understand all that. After that, a lot of it's a matter of rinse and repeat,
Right.
right? It's not
Right.
like we're changing our fat loss goals every single workout when they come to show up to see you, right? Like they know that there's going to be, 8 workouts this month, and then you're getting better on your own. So maybe you're going to choose to do 8 workouts again, or you're going to do 4 workouts with me and 4 on your own,
Yeah.
right? Like in terms of where we're going down the path, it's not like we're reassessing the goals every single time versus do you have pain? Do you have no pain? Right? Because in a
Right.
medical doctor office, you're giving a powerful chemical to blanket everything out. Typically, if I could comment to medicine, I'm not a medical doctor, so I don't like to comment too much on that part, right? I always
Sure.
say go to the proper professional for the proper opinion. But you're taking a powerful chemical, right? Versus when you're talking about natural health, you have inputs over time, right? And once we've measured the goals and we talked about neuroplasticity a bit in terms of inputs, it's a matter of rinse and repeat. It just so happens that with certain techniques, you will need a higher frequency of rinse and repeat to get a result. So
Right.
it's very important that you interview your chiropractor up front, right?
Yeah.
Like I love the idea of CBP, in terms of how they adjust and everything. Is that how I get adjusted every week? No. right? But I mean, my C curve looks pretty good. Last time I had it X-rayed, so
Sure. Nice.
in terms of, it was pretty close to 42 degrees, I think. So
Yeah.
if
That
we're
is the
talking
ultimate.
optimal,
That's the ultimate flex for a chiropractor. Well, my C spine is beautiful.
yeah,
My C
right.
spine like mine.
Uh,
That's
oh
Matt,
God,
fantastic.
on that note, I have a couple questions, Matt.
yeah,
They're unrelated, but the first one I'm thinking of is kind of just on the note of kind of what you mentioned there, but also going back when you're talking about like different functional tests.
yeah.
What are your thoughts on different tests that you use for an examination, being maybe resulting in false positives, just because, um, like what are your thoughts on it being a false positive and it being a result of just uh, uh, anatomical variation? Does
Oh,
that make
is
sense?
there? Yeah, like so. Is there a portion of the population that has a short leg based on bone length changes?
That, yeah, or just like
Sure.
kyphotic. A lot of people are just kyphotic and pain free, stuff like that too.
Kyphotic and pain for like thoracic spine, like hunched
Yeah,
over kind of thing, and their neck
yeah,
starting to change.
yeah.
Yeah, and I think if you look at the broad spectrum of people and the people that I see in terms of functional tests and in those that are optimal and move the best and have the most energy and vitality, probably their posture reflects that,
Okay. What does their
right?
posture look like?
Like based on observation over the past 9 years and then being taught things in school and whatnot,
Hmm.
I would say that, like you can't tell me that your thoracic spine is so kyphotic you're leaning over and then try to lift up your arm, right? Like
Yeah.
in terms of you start caving in your thoracic spine and then put the kyphosis in your neck and go this way, right? And then try and lift up your arm. Like what happens, right? Like you
Hmm.
Yeah, you're
can't
not
tell me
going
if
very far.
you can't bring your eye level up to neutral and your ear isn't almost over your shoulders.
Hmm.
Like, we're all talking a very similar language, just put in a different way,
Yeah.
right? Like if we talk about, like, you guys have seen like FMS with like Gray Cook
Hmm.
Yeah.
and anatomy trains with Thomas Meyer,
Hmm.
Yep.
right?
Yeah.
Like
The
those are
fascia
all
lines.
fascinating
Yeah.
things, right? But we're just, chiropractic has a unique place, but then there's all these other gentlemen who have come up with these different concepts, and I'm like, yeah, like chiropractors have been talking about that since 1895-ish, right?
Right.
It's just framed differently over the years, and then at the core of the chiropractic part is the nervous system and the perception the brain has with the rest of the body,
Interesting. Okay.
right?
The
So,
other.
oh,
Sorry. Go
sorry.
ahead. Go
No,
ahead.
I was just thinking back to like anatomy trains, like in terms of the line that goes all the way from like your heel, crosses over at like L5S1 and goes back up to the left hand,
Yeah.
right? Like those are some of the patterns that you may assess for as a chiropractor too. It's just the language is different, like it's more chiropractic terms,
Yeah.
and it may be variable. It's slightly different, right?
Right.
But it's
Right.
it's
Right.
almost like you're looking at almost the same thing, right? Which is the
Interesting.
neat
Yeah.
part.
Sure. Okay. Yeah. The the other question I had for you was just and you kind of touched on it a little bit, but I wanted to get into it, was you just being a massive proponent for lifting weights, exercise in general, but lifting weights. How does that fit in with your treatment philosophy and how you manage clients and patients?
Yeah, when I look after people, usually I give them something to do right off the get go, and tell them to, you can modify what you're doing, right? But I encourage them to keep going if they like it and it's keeping them motivated, because one of the worst things you can do is just stop and sit on the couch. So in terms of movement, it would be good for the healing process.
Mhm.
So if I can encourage them that way, that's great. Does everybody want to lift weights? No, right? And
Fair.
I've come to realize I can't like shove that down everyone's throat,
Right.
right? So if they can find what's working for them, make sure they're walking every day. Do I think it's optimal to make sure everyone squats once a week? Absolutely. Right? Do I think it's optimal to be checked by a chiropractor regularly? Absolutely.
Mhm.
Right? Whether you do those things or not is up to you.
Right.
Right?
Yeah.
So I think it's important that you make that distinction. As long as people know the consequences and they're okay with that, then go for it.
Right. Okay. How specifically can you talk about resilience and different things like that. Do you try and uh, I'm just trying to kind of delve deeper into how that really looks in your treatment philosophy. Like, are you Did you go through a journey in the past where you were kind of trying to, ram it into people's heads? You should pick up a barbell and lift weights, and then you'd realize like maybe some of your patients don't want to, and then you realize like, okay, the bigger picture of just exercise that they like to do is probably the best? Or how does that look? Do you do a lot of like recommendations for like, oh, you should try and like lift some weights or even do body weight stuff? Or
Yeah, I try to think with most people, less is more. Like
okay,
if you can get them, incorporating, regular mobility drills. Like if they can see the opportunity to spend 5 minutes a night to do something, no matter how busy they are, if you can teach them that, you know, busy is just a construct in their mind. Like that's one thing I talk about online, right?
try and
Is
tell
that
that to
like
a busy
if it's
person.
yeah, if it's important for you, you will make the time,
Yeah,
Yeah.
right?
it's true. Yeah,
So if you
yeah,
can carve out 2 to 5 minutes to do something for
yeah,
yourself, then I want you to do it. And I try to distill everything down to, the one or two things I want you to do regularly. And then if you like the gym, if they already say they go to the gym, I'll tweak what they do. Like they say, oh, I go to, the big box gym, blah, blah, blah. And they're having fun, enjoying it. So I say, why don't you I suggest these exercises they need to do and shift away from the machines. And, why don't you start picking up the barbell more? I will then, and I'll talk about it in my my newsletters and online. But if they have no interest in going to the gym, then I'm there for them when they're ready.
sure.
Yeah,
Nice. That's
Nice.
awesome.
That's cool.
Yeah. The amount of people that come into the clinic and then I'll be telling them that like, maybe, I want you to do this exercise, whatever it is. And they go, I just too busy. I go, okay. And the look on
yeah,
their face, they're expecting me to be like, no, but
get
like you
them on it.
have to. And I go, all right. And they go, "Oh," and you can tell they're waiting to like fight me back. And I go, I can't make you.
Yeah,
If you came in to see me and you didn't hear what I had to say, I don't know why you came here.
of
So I
course.
think, it's, and it just makes me laugh when I'm like, you have time. You 100% have it.
Of
Some
course.
people are more receptive and I'll go, but like, I try to make it as realistic as possible. So like you were saying that before, like I want everyone to be under a barbell, but if you don't go to a gym and / don't have a barbell, that's not realistic. So I'm like, here's an
Yeah,
exercise you can do literally on your floor. Like you don't need any equipment. And they go, okay. And I give them one. And the next time they come in, maybe I'll add something. And then they get a little bit more like excited. And then maybe you start going to the gym and then maybe they get under a barbell and it just makes me happy.
yeah,
But yeah, if anyone out there is listening, if you think you're too busy, you're not. You're
yeah.
lying. You're
It's
lying.
in
You're not
yeah,
too busy to take care of
and
yourself.
it's
Yeah.
so it's okay, right? You just have to realize you just have to be satisfied with the fact that you're gonna forgo that opportunity.
Yeah.
Like, maybe in the future there'll be an opportunity where you see it and you want to do it, but it's okay as long as you understand the consequences and the differences in your paths. That's okay with me. I want that to be okay with you as well, as long as you
Yeah.
understand that.
Yeah. Yeah. No.
Yeah,
Matt, I really want to emphasize something that like you've said it a few times, but I really want to emphasize in people's heads.
yeah.
Um, you get to interview your healthcare professional, your doctor, your surgeon, your massage
Oh,
therapist. I don't care who it is. You get to interview them. You get to
yeah,
question them. And if they don't have time for you, go find somebody else because they should have time for you. That's what you're there for. I think that's a fault of the system in, I guess, hospitals and just your your GP. It's a problem that like it's 10 minutes and you're out of there.
yeah.
But yeah, you don't
But
have to
don't
go to
forget though
anybody.
that that's a very overloaded system, right?
Exactly.
Like
Yeah.
they're
Yeah.
like 98% of them are caring, just like 98% of chiropractors are caring. It's just
Yeah.
I would say everybody's caring. They just have their own way of showing it sometimes, right?
Yeah. For sure.
So it's just a result of the system we live in, right? It's very overloaded.
For sure.
And you know I was talking to a friend, for instance, talking about overloaded, and he's a paramedic, and he said, oh, we're probably down, maybe half, right, half the calls. But
Wow.
doesn't that make you, aren't you curious, like what were those other emergencies, the other half that aren't coming in anymore?
Well, I think it was
Right,
emergencies in quotations. It wasn't really an
yeah.
emergency, maybe. Yeah.
And it's
For
important,
sure.
right, because everyone's emergency is their own emergency. And
Right.
Exactly. Yeah.
that's
For sure.
okay. It's just it makes you think twice right now, I guess, about going to the hospital with the current world situation.
Yeah.
So people are
Yeah.
like, oh, I'll just wait till the morning to call the urgent care center or they go to the
Yeah.
GP, right?
Yeah.
Or I just won't do
Exactly.
anything.
Yeah.
Yeah.
So
But
It's
yeah.
only bleeding a little bit.
Yeah.
Yeah.
Oh,
Maybe someone is listening to this, 2 years from now when this might actually make sense because no one's really going anywhere right now. But no,
yeah.
I got inspired from the book as well, Matt. It's just, you get to ask questions. And if someone doesn't want to answer your questions, if they want to be, if they don't want to be like asked questions, be like, oh, just listen to me, I'm the expert, then they don't deserve your time, really. Because I think it's a bummer if people don't
Yeah.
listen.
Yeah.
But yeah, that's why I
It's
think I like your stuff so much, Matt, is that like you seem actually caring. And it's like the most refreshing thing to see is that like, oh, you actually care about every single one of your patients that comes in. And it shows in all your content because you're like, here's what you can do at home. Here's what you can do here. Like, I'm going to teach you about what you need to know from the comfort of your own home. Potentially, it just shows that
oh,
you care.
well,
Yeah,
thank you.
you're welcome.
I
Shameless
know
plug for you, Matt.
it's hard to get it in their hands sometimes, right? Because I almost have a different following on social media compared to my office,
Right.
For
right?
sure.
Like sometimes I feel like there's very minimal crossover. But then when you realize they're actually watching the videos as well as they're in your office, like, okay, great.
Yeah.
You're
Nice.
getting
Yeah.
the support and everything else, right?
Yeah.
So
That's the
Fantastic.
ideal situation, I think. Eh?
yeah. Oh
Yeah.
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 Especially when someone tells me they started picking up a barbell too, since they came
Oh
in.
yeah.
They're like,
Yeah.
oh
Your
yeah, I
bias.
started
Oh,
doing this, and they started getting under a barbell and everything else. It's like great.
Well,
You
I
know,
don't know
it's
if you listen. I don't know how much you watch your analytics on social media, but do you notice the difference on Facebook and Instagram with yours?
yeah, the Instagram, like in terms of the differences in who watches more.
Yeah, just the demographics. Because like I
Yeah,
with me, I enjoy Instagram a lot, but the demographics there are generally not people who pay for in-person training. But Facebook would be where I would actually get business.
yeah. So, my average person who comes in is probably a 36-year-old female,
oh
roughly.
wow.
That would be me too. Yeah,
Yeah,
36 to
so
55. Yeah.
there's a crossover, but I noticed what I was thinking was the difference in the metrics are people connect with my personal posts a lot more than they do with my tips,
Mm,
right? Like my tips are speaking to a certain person that day
hmm.
in
Yeah.
terms of like, sore low back above the buttocks, what to do, right?
Yeah.
Versus, so when I put up a Easter thing there with my kids, it's like triple the amount of views,
Yeah.
Yeah. People do
right? Because
love
it's
that stuff,
personal,
eh?
right?
Yeah. Yeah.
Versus the other one speaks to a certain audience, and
Yeah.
it's more for me to be able to reference for you later on. Someone says, oh, I got this challenge and I can't come see you right now because of current world situation, whatever it may be. You can find the quick reference on my Instagram and send them the link.
Hmm.
Nice.
For reference, by the way, because we haven't even mentioned it yet, but if this is listened to 2 years ago, this is COVID-19 in 2020. We haven't said that
Oh,
Yeah.
yet, so they would be very confused.
yeah. Yeah.
If this is found in a time capsule somewhere one day,
Yep.
and now they know, oh, yeah, I read that in a history book. Yeah, it's
Yeah.
COVID.
Yeah. We're going viral in 2090, sir.
2019.
Yeah.
2090
Yeah,
between
that's
sets
it.
is huge.
Yeah, we're playing the
Oh,
long game. We're playing the
Uh,
long game here.
that's good. You got to play the long game.
Yeah.
And I know one of the important things is, just want to reiterate having that conversation and finding who's a good fit for you. But
Nice.
also, even amongst practitioners, I always like to think like, it would be a much easier, much better world if we just picked up the phone and called each other once in a while, right?
Agreed.
Because things get distorted on broken telephone, and it's much easier just to pick up the phone and call
Yeah.
and to say,
Nice.
hey, I got this patient here, blah blah blah.
Yeah.
They're looking for this.
Yeah.
I know you tried to help them, but was there something that didn't work out? Like, I
Yeah.
know there's some things with patient privacy in there, but
Yeah.
Yeah.
if you want to know what someone said, you can call up the other practitioner.
Yeah.
Right?
Yeah.
So,
I think
That's
that's
very
what I
true.
would do.
or you can ask
It's
permission, however
yeah,
it goes.
it's the most respectful way to do it. I think it shows that you
Yeah.
respect the other practitioner as well.
Oh gosh,
You know.
it's way better than I like to joke around as the tattletaling.
Right.
Like, okay, guys, like, come on, pick up the phone. Like,
Yeah.
we're all supposed to be professional here, right?
Yeah. Yeah.
So I just think it would be a much better world if we just all pick up the phone and communicated a little more.
Yeah.
Nice.
So, yeah.
God, Matt, you inspire me, sir. Because I'm always like, you inspire me to stop. Like, I've never seen you talk ill about anybody, and like, even on this podcast, me and Tim are talking about stuff, and you don't have a negative thing to say. And when me and Tim might be like challenging a thought, not of yours, but of other people,
Yeah.
and you inspire me to like take a step back and go, okay, why am I actually mad at, like, it's usually for myself, it's like other healthcare practitioners, I get like mad at what they're doing, and I'm like, be better. And I'm like, they're probably trying really hard. They probably do help people. I gotta relax, you know.
I think a
But
lot of it, they just have different objectives, right?
sure,
And that's where there's a lot of misunderstanding is like, many of the times you go to the family chiropractor, at least in my office, and the objective is to improve function
yeah,
from, typically from 0 to plus 10,
nice,
right?
yeah,
Versus many of the times you go to a practitioner and it's, hey, I'm at my -3, like I have symptoms and I just want to get back to my 0 state. I was happy with the status quo,
right,
right? Versus a lot of my questions to people really challenge your mindset.
yeah,
And sometimes that's completely offensive and that's okay. We'll take a break from each other, however that may work, right?
sure,
But if it, I really want to challenge your thought process because I want to inspire you to be the best version of yourself, right?
nice,
And sometimes people don't want to actually think for themselves, I think,
Oh yeah,
right? And if
definitely.
they want to just cruise through with the blinders on, and if all of a sudden I start asking questions of how you think about things and your health, then it may make you uncomfortable, right? And maybe you don't
Yeah.
have the, they don't want to carve out the time right now to work on that.
yeah,
So, and that's okay. It's just different, right?
Yep.
for sure.
Yeah.
So,
Well, this might be the perfect time for my perfect question.
what's that?
Oh shit.
If you
Hope
could,
you're ready, Matt. This is the gotcha question.
Gotcha.
you've had this
Good.
before, Matt. So you've had this before. So you filled in one already.
Oh,
So let's see if you have a
yeah.
different one. Yeah,
Good.
you said this
I
before.
forgot. Yeah.
If there's one thing you'd want every person on this planet to know, what would it be?
Can't give the same answer as last time.
Oh, that your health doesn't have to be defined by bad germs, bad genes, and bad luck.
Oh,
Nice. Okay.
I just want to end it right there. I just want like the outro music to play. That is beautiful, Matt.
Yeah, like
But
I
no, we're
think it
gonna
has much
continue.
more to do with the host in terms of how you look after your body,
That's
Cool.
in terms
awesome.
of being healthy.
Well said,
Yeah.
Matt.
Yeah.
Love it.
Yeah, I think hopefully this is a time where everyone gets inspired to be healthier. I think that'd be awesome. Like with
That
your
would
step
be my
challenge, I
goal.
think that's
I
a
think it's happening
fantastic start
too.
for.
Yeah.
I think so
Yeah.
too. Yeah.
Yeah. Seems like it. At
Yeah.
least at least people are doing it or putting it on the internet. So
Yeah, they're showing
I think
off.
it's I think it probably it's subjected to probably what do they call that? Self-selection bias or whatever, where it's all the people that are posting about it that are doing it.
Oh,
I'm sure
yeah.
there's a lot of people not doing it, but
Of
I don't know.
course.
Seems like a lot of people are trying, which is cool. I
Hey,
know I've tried to do new stuff that I normally wouldn't want to do. So
they all supported it, which was great.
yeah.
So
Yeah.
even if
Yeah.
they're not walking, I'd love to see you walking too. It's a bonus.
Yeah. Oh
No,
yeah.
it's very true.
Yeah.
Very true.
Matt, do you want to plug your stuff? Like tell people where you practice and how to get a hold of you?
Sure. Yeah. I mean, I'm here in Georgetown. You can reach me by phone, right? If you want to schedule something.
Mhm.
But I do a lot of Instagram at Matt Bradbury OLF, MATT BRADBURY, and then the initials OLF. But Instagram, Facebook, and my step challenge, right, which I've been
Oh
working
yeah.
on for a while, like
Yeah.
in terms
Oh,
of
yeah.
the Ronald McDonald House fundraiser.
Mhm.
But if you want to connect, ask me a question, get the conversation going, and I will definitely, reply back to your DMs
Nice.
and be helpful. And when ever you decide you need a chiropractor, I'd love to be your chiropractor.
Love
That's
it.
awesome.
There's a
Yeah.
pitch.
Cool.
What
Yeah.
a
Beautiful.
wholesome pitch.
Yeah.
Love it.
Awesome. Well, I mean, that's a perfect place to end, fellas. Thank you, everybody, for tuning into the show. Hope you enjoyed it. Again, if you have any questions for Matt, he's more than happy to field them, of course, like you just said. Same thing for Tim and I. I have, weirdly enough, an abundance of time right now to answer any and all of your questions.
Of course.
So
Yeah.
you guys let me know. Hope everyone's doing well, and we'll catch you on the next one.
Cool. Thanks for
Absolutely.
listening, guys.
Thanks for